Good morning, ladies and gentlemen. My name is Dorothy Baziwe. I am from Uganda. Our organization is called Sheltered Settlements Alternatives, Uganda Human Settlements Network. It's a bit of a long name because it's an NGO that is also hosting a network. A little bit about Uganda. Uganda is a small country that has been dealing with the HIV and AIDS epidemic since the 1990s. Our figures, according to UNAIDS, show that we are doing good work. However, us in Uganda, we have a few queries about that good work that we're being reported to have done in curbing the epidemic. This is because a recent study showed that 99% of the Ugandans actually know that HIV and AIDS actually exists. But when you go into what do they know, you find issues of stigma, issues of non-disclosure, discordant couples, criminalization of acts, as I'm sure Uganda is famous for. And such issues mean that the knowledge, the comprehension goes down from 99% to 43%. So we still have a very big gap in addressing HIV and AIDS. As an organization, we come together to be able to address issues of human settlements, that is mainly housing, and looking at these different mainstreaming issues that include HIV and AIDS, gender, and environment and climate change. As an organization, we carried out an action research that was looking at the link between HIV/AIDS and housing. It was the first done in Uganda, and it is still what we are referring to as a country. Some of the findings from this research showed that there were rampant evictions of people living with HIV/AIDS because landlords feared that they would probably die in their houses, or they would probably devalue the houses that they were living in. We also found that people lacked the knowledge of where to seek legal recourse in case their land was grabbed for the widows or the orphans, or they were unlawfully evicted. Some of the business owners who were affected by HIV also were highly stigmatized by their customers. For example, we found one incidence of a restaurant which was closed because it was known by the community that the owner was HIV positive. We found that people living with HIV and AIDS were unable to save for decent housing due to the high treatment costs. Uganda is a country that does not have medical coverage for things such as HIV, and as we all know, sometimes these costs are very high. We also found that access to public toilets, because most of these people live in informal settlements and have to use communal facilities, and we found that it was expensive because these people were looked at as people who were not acceptable. If you share with them, you probably get HIV or something. So we found that people were actually resorting to open defecation rather than actually using the public toilets. We found that also in the communities where we were working, overcrowding and inadequate ventilation posed health risks to these people because they were more susceptible to opportunistic infections. Also, another finding was that home-based healthcare services were difficult because in the informal settlements, there are issues like floods, poor sanitation, poor waste disposal, and generally filthy environments where the health workers do not want to actually venture. Also, storage of the medication was very inadequate due to the hygienic conditions of the houses. In another research that we looked at the impact of HIV on our communities where we work, we found that the negative behavior of the landlords towards those who disclosed that they were actually HIV positive was actually degrading their psychological well-being. We also found that cultural factors meant that, for example, if a woman who is left helpless and her husband dies with HIV, the family normally grabs their land and evicts this woman and her family, and she has no place for recourse. We also found that the stress impact for evictions was high in females mainly, because they are the ones who are the homemakers and they were considered the most vulnerable. We also found that the females, their CD4 count really highly reduced when they faced evictions and illegal practices as such. As a result of that, ours was basically action research that is looking at interventions on how to change the situation. One of the things we do is to provide support. Currently, we have 8 community groups that are affected by AIDS. We support them with income generation activities like basket weaving, urban gardening, and such interventions that help them to improve their sustainability. We also do community cleanup campaigns with the communities where we teach practices like waste disposal, garbage disposal, environment practices, and making areas habitable to the advantage of people living with HIV and AIDS. We continue looking at profiling exercises so that we are able to address our interventions to be adequate to what the communities actually need. We also do a mainstreaming training for the network members. As I told you, we're a network. And we also are working on developing national eviction and resettlement guidelines for the country. As you can see, the situation is a constant eviction of people living in informal settlements, and our reaction to this is training of the communities in paralegal training so that they can be able to address their legal woes. Some of the things that we've learned that we really promote are community mapping and enumeration, continued advocacy, and also demonstration as a way to be able to yield evidence for advocacy. One of the strategies that we've done with that is to build, we have a pilot project that is constructing houses for cooperatives in Uganda. I won't go into our recommendations because those you can read up on. We're learning to do it right by recognizing that housing is a strategy for prevention and care of HIV. Thank you, or as in my language we say, mwebalenyo.